Hi, my name is Somali Mancharola, and today's topic in this presentation will be rheumatoid arthritis. To begin with, if you asked a group of people what they think the cause of arthritis is, I feel like more than half of them would say that the cracking of the knuckles would be the cause. And I would probably say that as well, but after doing some research, it actually has nothing to do with it at all. And this popping that you're hearing is just from the pressure and the nitrogen gas in the joints that are being produced when you crack the joints. And you're just really hearing the little nitrogen gas bubbles pop. But if you do experience pain, this may actually be an early sign of arthritis and is really important to go check it out as early as possible to really prevent short and long-term consequences that come with it. Rheumatoid arthritis attacks different parts of the body. There's ways to treat and alleviate the pain that comes with it, as well as ways to possibly prevent developing this condition, which I will discuss later in the presentation. So what even is RA? Rheumatoid arthritis is a chronic progressive disease causing inflammation in the joints and resulting in painful deformity and immobility, especially in the fingers, wrists, and ankles. And what actually happens when you have rheumatoid arthritis is when your own immune system is actually attacking the synovium in your joints, which is the linings of the membranes that surround your joints. And the inflammation resulting from these attacks actually thickens the synovium, which with time will destroy the bone and cartilage itself. And mostly the small joints of the hands, wrists, and feet are affected. In some other cases, the knees, ankles, shoulders, hips, and elbows can be affected as well. And for the patients with RA, the pain that they endure can be completely disabling, caused by all this inflammation in the joints that are stiff, red, and swollen. So like I said before, it's most important to treat rheumatoid arthritis at the first signs of symptoms, because this condition can begin with only one joint. If not treated, it can evolve into many other joints, even on both sides of the body. And about 1.5 million people in the United States have rheumatoid arthritis, and nearly 3 times as many women have the disease. So it's really important for women to look out for their health to really prevent a disease like this in the future. This next image kind of shows how rheumatoid arthritis affects both of the joints symmetrically. So it may begin with a couple of joints only, and like it says here, most frequently attacks the wrists, hands, elbows, shoulders, and knees. And if left untreated, it can evolve into all these joints eventually. So currently there's no known cause for arthritis, which really makes it like 10 times more difficult to prevent it. And they're saying that possible genetic components are appearing in patients, and that your own genes actually make you more susceptible to environmental factors such as infections and with certain viruses and bacteria which may trigger the disease. And also, research results found human leukocyte antigen HLA that controls immune responses, and they found these on the surface of white blood cells in some patients, which they believe that increases the chance of a patient to develop RA. But I did also read that not all patients that had the HLA on their white blood cells developed rheumatoid arthritis, so this still questions what the actual cause of rheumatoid arthritis is. But some other big factors that play a role in the cause are smoking and obesity, but both of these factors really can cause other diseases as well, so preventing these would help your health overall. This next slide shows kind of some stages of the rheumatoid arthritis. This is really what the joint should look like. And as you can see here, when you get arthritis, you can see the different changes, and eventually the bones fuse together, which gives the look of the deformity in the hands. So what actually is affected by rheumatoid arthritis? Skin is one thing affected by RA, and half of the patients develop rheumatoid nodules, but they actually may sometimes disappear on their own without treatment, so they're not too bad. Also, inflammation in the eyes, known as scleritis, may develop, which causes pain and blurred visions, but can be treated with special eye drops as well. Also, patients with rheumatoid arthritis also tend to have a higher rate of developing gingivitis, so oral hygiene is really a must, and it should be in general. Also, about 1/3 of patients with RA will develop some type of lung or pulmonary symptom. Pleurisy is an inflammation of the lung lining, and it can make it difficult to take a deep breath, but it is also treatable with anti-inflammatory drugs. Also, rheumatoid arthritis may come with nerve problems in the arms and legs, for example, carpal tunnel syndrome, which causes like numbness and a decreased grip and strength, which really prevents you from doing a lot of activities and chores that you need to do around the house or in your life, really. Some signs and symptoms that most patients with RA report and that are the most common are fatigue and joint redness, joint pain and joint swelling, joint warmth, joint stiffness. Mostly the small joints in the hands, the wrists, and the feet are affected, and other and more severe cases, the knees, ankles, shoulders, hips, and elbows can be affected as well. Also, like I mentioned before, firm bumps of tissue under the skin on your arms can develop, which they are the rheumatoid nodules. And some patients also reported feeling fever and weight loss as well. So, since there really is no known cause for the um, rheumatoid arthritis, there's no actually official cure as well as a way to prevent it. But there is medications that are prescribed to patients. They're most commonly used to reduce the inflammation and the pain to prevent or slow down the joint damage. And the most common medication given to patients is a non-steroidal anti-inflammatory drug, which can reduce the pain and inflammation, but it does come with side effects that may include stomach irritation, heart problems, and kidney damage. And honestly, most of the medications that they give you for rheumatoid arthritis can actually either make the disease worse or, you know, not even help it at all. So, other ones that are also prescribed are steroids and disease-modifying anti-rheumatic drugs, and they're also used to treat RA but come with harmful side effects as well, like I mentioned before. If those don't really help, therapists are also sometimes assigned to work with patients, and they teach them exercises to keep the joints mostly flexible and moving, and also just suggest ways to do daily tasks that would be easier on the joints and won't put too much stress on them. And if medications and therapy fail to prevent or slow joint damage, doctors may suggest surgery to repair the joints that are damaged, and which may help restore the patient's ability to use that joint ever again, actually. So for prevention, like I said before, since there's no known cause of it, there really is no known way to prevent it. And the most important really is to treat the early signs of inflammation, because that is the best and most effective way to really prevent a more severe case of rheumatoid arthritis. But gentle stretching and keeping the joints flexible and moving can also prevent it, as well as quitting and preventing smoking can reduce the risk as well. RA can also come with long and short-term consequences, and the long-term damage to the joints are actually irreplaceable damage to your whole body. It comes with constant pain and disability if left untreated, and you can't really do much about it after the joint is already damaged unless you get some type of surgery like I mentioned before. And joint pain is commonly just a short-term complication, which can lead to infection if no attention is paid to it as well. But persistent untreated inflammation can actually lead to a shorter lifespan because it can cause heart disease and narrow blood vessels and many other risks that can pop up in life. That slide here kind of shows the late stage of a rheumatoid arthritis patient. You see the bony deformity of the thumb over here, and as well as the ulnar deviation of the metacarphalangeal joints, and the swan neck deformity at the tip of the fingers over here. And this is really what it would look like if you just completely leave the the disease untreated or just don't, treat it in the early signs, which is really the most important. So, I've always just worried myself about developing rheumatoid arthritis in the future since my brother actually is diagnosed with it. But after doing some research, I probably should not be too concerned because your genes aren't actually what causes it. So don't think I'll be too worried about getting it passed on from a family member. But your genes actually make you more susceptible to the environmental factors, like I mentioned before, like the infections with the viruses and bacteria that may trigger the disease. So now I know somehow a way to prevent it by just eating healthier, exercising, not smoking, and things like that. And since there's no official cure for rheumatoid arthritis, it really is a long-term commitment, and not all the treatments work the same on every patient. So each patient should not be discouraged if a treatment didn't work for them. They just must just give their body time to respond to a certain treatment to find the right one for them. And since this disease is prolonged, individuals must really uh, find a doctor they're really comfortable with, and since they'll probably be dealing it for most of their life. And like I said, the most important thing with rheumatoid arthritis is to treat the condition at the early signs of symptoms to really prevent joint damage in a long-term condition in the future. And that concludes my presentation, the references, and that is it. Have a good night. Thank you.